Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you are interested in, please make sure to subscribe now. You hit the notification bell so that you will be the very first to watch my newest uploads. Also, do not forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everybody, how are you guys doing? Malapit na nga matapos ang taon and this is another entry natin sa ating nursing test banking. Alam ko nga na karamihan sa inyo ay naghahanda na and nasa, vacation mode, but that doesn't mean that you were not going to prepare for your upcoming exam. I want you to take this time to really give yourself and to at least do not, destroy or what you call this? I'm thinking of better word to use. Not interrupt or not destroy your rhythm, your flow for studying. All right. This is going to be just like 30 minutes or 25 minutes of your time to sit down with me, listen to, and take the exam with me. This is just 10-minute examination that will cover your maternal and child practice, PNLE. Alright? Ngayon, gusto ko lang mag-congratulate sa lahat ng mga test passers natin dyan. Congratulations sa inyong lahat. You deserve it. Marami nga sa inyo ang bumabalik. Ang talaga namang nagpapasalamat. Excuse me, my throat. Nagpapasalamat kasi malaking tulong daw yung mga nursing education na videos ko sa pag-aaral nyo. Nako, nakakataba po ng puso. You guys all deserve the glory. Maraming salamat po and congratulations. Ngayon, kung di mo pa napapanood yung other nursing test banking videos I created under my channel, I'll be putting the actual playlist link on the description box or whenever the icon button pops out. Click the one out because I'll be putting it there together with the other playlist I have on my channel. Malaking pasasalamat nga because this year, you guys made it. We made it to 17,000 subscribers. I'm hoping next year we'll be able to hit the 50,000 mark. So, yeah, I'm just putting out there and I know nothing is impossible with you guys. You know, let's grow this community of nursing students and nursing professionals trying to learn and review and refresh our knowledge when it comes to nursing practice. All right? So, mag-proceed na tayo. Eto na. Let me give you the objectives. Well, we'll only have 2 objectives every time we do a nursing test banking. One, I'm going to provide and discuss board exam type of questions. 2, I am going to provide rationalization per each board exam type of question. And if there's nothing that I want you to take away out from this video, that is the rationalization. Because I want you to have the full grasp. I want you to learn how to attack certain questions. I want you to learn to strategize with me. How are you going to approach certain questions? Spot the key terms and help them lead you to the right answer. All right? Eto na tayo. Let me give you the instructions for today's exam. You'll be given 10 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. You choose the letter of the correct answer. Good luck, nurses. Take this exam or this video exam as if this is the last question on your PNLE. Last 10 questions na. How would you like to perform in these last 10 questions? Because these 10 questions can make or break the result of the examinations. Alright? Damdamin mo, lasapin mo yung rationalization. Magsisimula na tayo sa question number 1. Which of the following common emotional reactions to pregnancy would the nurse expect to occur during the first trimester? Oh, kunin mo yung pen mo. I-mark mo yung mga key terms. First trimester, expected to occur. Meaning, what are those manifestations that a pregnant lady can experience during first try? Pretty straightforward. Now you choose. Is it A, introversion, egocentrism, or narcissism? B, awkwardness, clumsiness, and attractiveness. C. Anxiety, positivity, extroversion. Or D. Ambivalence, fear, and fantasies. Which one of these is most common in first try? Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Ambivalence, fear, fantasies. Let me explain to you why. Now, during the first trimester, common emotional reactions include ambivalence, fear, fantasies, or anxiety. The second trimester is a period of well-being accompanied by the increased need to learn about fetal growth and development. So, kumbaga, sa first trimester, emotionally, ang mga mothers is parang nangangapa pa. Hindi pa nila alam yung gagawin nila. Buntis ba ako? Ito ba talaga ito? Ito na talaga to yung hinihintay kong matagal na ganon. Siyempre, kasama na rin doon yung anxiety. Kasi fear of unknown. Hindi nila alam, ano nang gagawin ko? Normally ito, especially doon sa mga first-time moms. Now, common emotional reactions during this trimester include narcissism, passivity, or introversion. At times, the woman may seem egocentric and self-centered. During the third trimester, the woman typically feels awkward, clumsy, unattractive, often becoming more introverted or reflective of her own childhood. Malinaw ba yon? Malinaw. Eto na talaga tayo. Question number 2. During which of the following would the focus of classes be mainly on physiologic changes, fetal development, sexuality, during pregnancy, and nutrition? Tinatanong ka, first try, second trimester, saan kadalasan magmamanifest itong mga symptoms na to? Fetal movement, sexuality, during pregnancy, and nutrition. Aling part of pregnancy? Is it A, pre-pregnant period? Is it B, first trimester, C, second trimester, or D, third trimester? Kung nakinig ka sa rationalization sa number 1, masasagot mo ito. Your 5 seconds starts now. Time is up. What is your answer? The answer to this is letter B. Very good. Why? First trimester classes commonly focus on such issues as early physiologic changes, fetal development, sexuality, during pregnancy, and nutrition. Some early classes may include pregnant couples. Second and third trimester classes may focus on preparation for birth, parenting, and newborn care. Alright? Malinaw ba yun? Malinaw. Proceed na tayo. Board exam type of question number 3. Which of the following would be disadvantage of breastfeeding? Tinatanong ka naman, kabaliktaran. Disadvantage daw ng breastfeeding. Very straightforward ang tanong. Mamili ka sa mga choices na to. Is it A, involution occurs more rapidly? Is it B, the incidence of allergies increases due to maternal antibodies? Is it C, the father may resent the infant's demands on the mother's body? Or D, there is a greater chance for error during preparation? Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter C. Disadvantage ng breastfeeding, ang letter C. The father may resent the infant's demands on the mother's body. Why? Listen to this. With breastfeeding, the father's body is not capable of providing the milk for the newborn, which may interfere with feeding the newborn, providing fewer chances for bonding. Or he may be jealous of the infant's demands on his wife's time and body. Breastfeeding is advantageous because uterine involution occurs more rapidly, thus minimizing blood loss. The presence of maternal antibodies in breast milk helps decrease the incidence of allergies in newborn. A greater chance for error is associated with bottle feeding. No preparation is required for breastfeeding. Hence, the answer to this question is letter C. Malinaw ba yun? Malinaw. Eto na tayo, board exam type question number 4. Which of the following would cause a false positive result on a pregnancy test? Very straightforward ang tanong. Alin daw dito ang pwedeng maging sanhi, maging cause ng false positive result ng pregnancy test? Is it A, the test was performed less than 10 days after an abortion? Is it B, the test was performed too early or too late in the pregnancy? C, the uterine sample was stored too long at room temperature? D, A spontaneous abortion or a misabortion is impending. False positive result ng pregnancy. Alin dyan? Your 5 seconds starts now. Time is up, you guys. What is your answer? The answer is very good. Letter A. The test was performed less than 10 days after an abortion. Why? Listen, a false positive reaction can occur if the pregnancy test is performed less than 10 days after an abortion. Performing the test too early or too late in the pregnancy, storing urine sample too long at room temperature, or having a spontaneous or misabortion impending can all produce false negative results. Alright? Eto na tayo. Nangangalahati na nga tayo sa exam natin for today. How are you guys doing? Nakakahinga pa ba? Ayan, very good. Eto na. Question number 5. FHR. Ano yung FHR? Wag kang bungol. Fetal heart rate can be auscultated with a fetoscope as early as which of the following? Very common. Tanong at lumalabas sa board exam. Sometimes situational, sometimes direct forward, such as this one. Kailan mo maririnig sa fetoscope ang FHR? Anong weeks of gestation? That is the question. A, 5 weeks gestation. B, 10 weeks of gestation. C, 15 weeks of gestation. D, 20 weeks of gestation. Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter D, 20 weeks of gestation. Roughly 4 months. The FHR can be auscultated with a fetoscope at about 20 weeks gestation. FHR usually is auscultated at the midline suprapubic region with Doppler ultrasound transducer at 10 to 12 weeks gestation. FHR cannot be heard any earlier than 10 weeks gestation. Alright? So, less than 10 weeks, hindi mo pa maririnig yung fetal heart rate niyan. Alright? So, what you're gonna do is to do an ultrasound instead. But if you're using a fetoscope, you have the pregnant lady should at least be 20 weeks gestation or 4 months old baby. Alright? Eto na talaga tayo. Bago ko basahin ang question na ito, I want you to please subscribe now. Kung hindi ka pa nagsasubscribe, nakakahiya naman sa'yo. Charing, eto na. Question number 6. A client LMP began computation ng LMP last menstrual period, which is expect mo nang marireceive mo at matatanggap mo ang tanong na ito. Ma-encounter mo itong tanong na to pagdating ng board exam. So, a client LMP began July 5. Her EED, expected date of delivery, should be which of the following? Very direct forward. Computation ng EED. Binigyan ka ng value. LMP, July 5. What is the answer? Kung medyo mahaba, kung medyo mabilis yung 5 seconds, pwede mo namang i-pause at mag-compute ka dyan on the side. Alright? A, January 2. B, March 28. C, April 12. Or D, October 12. Your 5 seconds starts now. Time is up. What is your answer? Very good, nurses. April 12 is the right answer. Wala nang iba. To determine the EED, ito, i-refresh ko ang knowledge nyo ha. When the date of the client's LMP is known, use NAGEL rule. Naalala nyo si NAGEL? To the first day of the LMP, add 7 days. Subtract 3 months and add 1 year, if applicable, to arrive at the EED as follows. So, ano yon? 5 plus 7 is equals to 12, which is July. Minus 3 is equals to 4, which is your April. Therefore, the client's EED is April 12. Oh, malinaw ba yun? Malina. Ito na tayo. Board exam type of question number 7. Which of the following fundal heights indicates less than 12 weeks gestation when the date of the LMP is unknown? Ito. Hindi alam ang LMP. Unknown. Anong fundal height ng pasyente mo ang magsasabi sa'yo na 12 weeks gestation ito? Simple question. Magpahirapan ng sarili mo. Is it A, uterus in the pelvis? Is it B, uterus at the xiphoid process? Xiphoid process agad? Is it C, uterus in the abdomen? Or D, uterus in the umbilicus? Your 5 seconds starts now. 12 weeks, huh? Time is up, you guys. What is your answer? Very good. Letter A, uterus in the pelvis. When the LMP is unknown, the gestational age of the fetus is estimated by the uterine size or position. Fundal height nga po. The presence of the uterus in the pelvis indicates less than 12 weeks gestation. At approximately 12 to 14 weeks, the fundus is out of the pelvis above the symphysis pubis. The fundus is at level of the umbilicus at approximately 20 weeks. Kapag naman, gestation and reaches the xiphoid at term of 40 weeks. So obviously, xiphoid process is very wrong kapag titingnan mo yung given sa yung value which is 12 weeks. Alright? Next, board exam type question number 8. Which of the following danger signs should be reported promptly during the antepartum period? Alin daw ditong danger signs ang sasabihin mo agad sa doktor during the antepartum period? Is it A, constipation, B, breast tenderness, C, nasal stuffiness, or D, leaking amniotic fluid? Antepartum meaning bago manganak. Alright, your 5 seconds starts now. Tulungan kita. Alin ba dito, based dito sa mga given choices, alin dito ang life-threatening? Constipation? Mamamatay ka sa constipation? Mamamatay ba si baby sa constipation? B, breast tenderness? Sige. Is that something urgent? C, nasal stuffiness? Baka naman may sipon lang si mother? Or D, leaking of amniotic fluid? Between these 4 choices, which is the most in danger, which is the most dangerous? Of course, letter D, leaking amniotic fluid. Danger signs that require prompt reporting: leaking of the amniotic fluid, vaginal bleeding, blurred vision, rapid weight gain, and elevated blood pressure. Diba? Para yan sa mga dito, para ma-monitor yung mga elevated blood pressure saan? Sa mga, anong tawag nga doon? Eclampsia. Mothers natin. Constipation, breast tenderness, and nasal stuffiness are common discomforts associated with pregnancy. Period. Last 2 questions make this one count. Question number 9. Which of the following prenatal laboratory tests values would the nurse consider as significant? Alin daw dito sa mga laboratory values na to ang pinaka-importante? Is it A, hematocrit 33 to 5%? 33.5%, I'm sorry. Is it B, rubella titer less than 1:8? Is it C, white blood cell count of 8,000 per cubic millimeter? Or D, 1 hour glucose challenge test, 110 grams per deciliter? Your 5 seconds starts now. Ngayon, turuan kita paano mo i-attack tong klaseng ganitong question. Kapag given ka ng mga laboratory values na yan, spot on which one is within normal values. Because meaning, alin daw dito yung pinaka-significant. Meaning, hahanap ka dito ng deviated from normal. Meaning, mas mataas yung value, mas mababa. Alright? This question is asking for you to choose B. Rubella titer less than 1:8. Why? A rubella titer should be 1:8 or greater, not less than. Malinaw ba yon? Thus, a finding of titer less than 1:8 is significant, indicating that the client may not possesses immunity to rubella. Meaning, pwede magkaroon ng rubella si mommy during pregnancy at it can lead to abortion. A hematocrit of 33.5%, a white blood cell count of 8,000, and a 1 hour of glucose challenge test of 110 grams per deciliters are all within normal parameters. Malinaw ba yon? Malinaw. Last question for today's exam. Make this one count. All right. Question number 10. Which of the following characteristics of contractions? Nahuli pa yung pagkakasabi ko. Contractions would the nurse expect to find in a client experiencing true labor? Meaning, the question is asking you to define what is true contractions. That was just it. Is it A, occurring at irregular intervals? B, starting mainly in the abdomen? C, gradually increasing intervals? Or D, increasing intensity with walking? Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter D, increasing intensity with walking. With true labor, contractions increase in intensity with walking, meaning regardless of the activity of the mom. In addition, true labor contractions occur at regular intervals, usually starting in the back and sweeping around the abdomen. The interval of true labor contractions gradually shortens. All right. Thank you so much, you guys, for watching. Hope you learned something for today. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Ano nga po ang mga score nyo? Pakilagay sa baba. There's no shame, no shame. Pinaghirapan mo yan. I would just like to know your scores because I would like to evaluate the scores of my students. Thank you nga po. Abangan nyo nga po yung next upload natin next week, because it's going to be amazing. Alright? So kung hindi ka pa nagsasubscribe, mag-subscribe ka na. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, pinakabago, pinaka-fresh at pinakalibreng nursing review center sa balat ng YouTube. And don't forget to follow me on all my other social media accounts. Everything is at Neil Gave, except for my TikTok account, which is Neil Gave Official. Follow me, rate, and subscribe to my podcast channel. It's 3 a.m. Conversation with Neil Gave, and you have a great one.